joined by Dr. Sanjith Saseedharan, who is the head of critical care at S L Raheja Hospital, to help us understand and demystify what exactly is MPOX and how much of it could be a concern back home here. A very good afternoon to you, sir. Doctor, thank you so much for joining us on ET Now. And let's talk about MPOX, because this is the second time in 2 years that it has been declared as a public health emergency.
Yeah, you're right. Good afternoon to all. And yes, this is the second time that this has been declared as a global emergency. But importantly, we must not panic, because monkeypox, unlike COVID, is not as transmissible as it was thought. The very fact that the first time the global pandemic came by and went by, we most of us didn't even realize that it came in. The chances of it getting into our country, apart from getting imported from outside, is very minimal, and the transmission risk also is not as much as what we thought when COVID came in. So it's definitely this way, that this particular disease, which is spread by a virus, a DNA stranded virus, which can spread, which is self-limiting in 21 days. Which comes with fever, nausea, and a skin lesion and lymphadenopathy, would actually die down its own death, is what I feel per se, if it's limited in its place.
You just highlighted a couple of symptoms that you're likely to witness in that. If you could elaborate a bit more on what sort of symptom one should be concerned about, or keep a close eye on for MPOX?
Yeah. So most of these monkeypox diseases have come with fever, a myalgia, a headache, and then it starts with a rash. It's a prodromal symptom that starts with fever, myalgia, headache, and then a rash comes by. This rash per se moves from being a macular rash, means it's a flat top rash, to a papule, to a vesicule. And classically, these are hard punctate vesicles. Umbilicated rashes is what we normally see in such cases, which last for around 21 days. And a very minority of them actually go into very difficult respiratory illnesses, which we have seen from Africa, which actually goes down. Apart from this, there are certain swellings that you might find in the throat region, which is called as lymph nodes, and this is called as lymphadenopathy. These mucosal lesions are quite surprising also. There are some mucosal lesions that are also seen in the mouth, and these rashes are known to start from the central region and then go towards the peripheral region, contrast from other rashes that start from the periphery and then comes to the center. So these are the usual features that come in with monkeypox, with MPOX, yes.
Also, sir, if you could tell us what are the solutions available for treatment when it comes to MPOX? Which medicines are used? Is there any other form of drug that can be used to treat MPOX?
So 99% of cases will recover with simple treatments like paracetamol, rest and isolation, so that you don't spread it to other people. However, we are very advantaged. We are at a very great advantage when it comes to MPOX, because we already have medicines to treat this. Tecovirimat is an antiviral that has been approved for the treatment of monkeypox, which can be given even after the person gets monkeypox. At the same time, there are vaccinations that are also available, which have proven that it is very effective. So we are quite ahead in the game when it comes to MPOX. There are 2 vaccines that have been used for high-risk occupational exposure, as well as people who might get this particular disease. And to say which of those patients might get it, at least from the outbreak that happened last in 2022, we know that those patients who had close male-to-male sexual connections did have this particular disease very often. HIV patients and those on immunocompromised, immunosuppressed medications, they also have got a high risk of getting this particular illness. Yes, so we are well prepared is what we...
Right, we are well prepared, and hopefully it is contained way before time. Thank you so much, Doctor, for joining us on the show to talk about exactly what MPOX is. And yes, for now, there are no cases reported in India, but what are...
If you like this video, then like, share and subscribe to ET Now.